Feel the waves cut through me, hypnotized by the sounds of...
Kamakailan po ay inanunsyo ni Presidential at IATF spokesperson Harry Roque na kasama na rin ang mga nasa A4 priority list o mga tinatawag na economic frontliners sa mga pwedeng bakunahan laban sa COVID-19. Kaugnay rin yan ng pagpapalawak ng National Vaccination Program ng pamahalaan, pero ang problema, tila may kakulangan pa rin sa supply ng mga bakuna. Para pag-usapan yan, we are joined by the WHO representative to the Philippines, Dr. Rabi Abengyasing. Good morning, Dr. Rabi.
Morning, Yusek Rabi. Happy to be here.
Thank you. Doctor, may we get your reaction on the government's move to start the inoculation on our economic frontliners, including teachers, public utility workers, media, and the diplomatic community?
Thank you for the question. It is an important element in the vaccine response. They are certainly envisaged to be covered in the WHO's prioritization groupings. What we are currently experiencing, however, is because of the difficulty in accessing vaccines. We need to still prioritize and ensure full coverage of the frontline healthcare workers. Right now, we are happy to note that the Philippines has provided vaccinations for almost 1.25 million people. Of that, nearly 63% of the frontline workers have been protected. So we're still short of protecting all the frontline healthcare workers, and the current surge demonstrates that we need to have healthcare workers fully protected so that they can work to care for the sick and help them heal. So we continue to emphasize that let's work on a priority basis to protect the frontline healthcare workers, and then move gradually to the other groups that have been identified. WHO agrees to these groups, but following the prioritization is important to maximize the impact of the vaccination as an additional tool in the entire COVID response. Thank you.
Dr. Rabi, we know that the COVAX facility's main objective is to distribute COVID vaccines fair and square among participating countries. However, there are reports of alleged hoarding by vaccine-producing countries. Can you confirm this report? And what is WHO and the COVAX facility doing on this?
So our Director General early on identified this as a global moral failure that we are not distributing vaccines equitably to protect the most vulnerable and at-risk populations. And this is precisely why 1 year ago WHO conceptualized with key partners the setting up of the COVAX facility. We continue to see that the majority of vaccines are being procured by high-income countries, while there is significant impact of the pandemic affecting frontline health workers and elderly people in many of the least developed countries and middle-income countries. So we continue to urge countries to share vaccines and make available all technology and share technology so that other countries can also join in increasing the production capacity of vaccines so that the vaccine distribution can be done more equitably and more quickly. Thank you.
Dr. Robert, as per the estimation of the United Nations, only 10 countries had so far accomplished around 75% of their vaccination program. With the rate that this is going, plus then even access to vaccine caused by the alleged hoarding, how far are we in defeating this pandemic?
So I want to reiterate, Yusek Raki, that we view the vaccines as one additional tool in our overall response, and having vaccines is critically important, but we still emphasize that we can significantly reduce transmissions by properly implementing the minimum public health standards and the non-pharmaceutical interventions while we wait and while we work towards making vaccines widely accessible. So I think we need to recognize the realities. We have been fortunate that we have vaccines that were developed within 1 year of the pandemic. This is indeed unprecedented success. And as we make them more accessible for all countries, we can still do a lot by ensuring that we practice the protocols that have shown that we can suppress transmission by complying with these guidelines. So let us do what we can, and we will continue to work to ensure that we can access vaccines as quickly as possible.
Dr. Rabi, apart from the AstraZeneca vaccine, the Johnson & Johnson vaccine also has a serious concern about, over the blood clotting incident on its vaccinees. Now that it is securing an EUA from our FDA, does the WHO stand firm in its recommendation to push through with the rollout of these vaccines despite this concern?
So this is an interim position because we are looking very closely at the evolving evidence. Both the AstraZeneca vaccine and the Johnson & Johnson vaccine are viral vector vaccines, and they seem to be associated with what we call TTS, or thrombosis with thrombocytopenic syndrome, in very rare situations. Now, it's critically important that we gather more information and understand what is the connection and how does this happen and who is at risk, while we work on these fronts together with many of our partners and research institutions and indeed the vaccine manufacturers. It is clear that the evidence strongly supports our continued use of the vaccines, because the lives we will protect by the use of the vaccines through the prevention of severe disease and deaths would be significantly greater than the rare occurrence of these events, TTS events, that have been identified. At the same time, we are also making efforts to strengthen surveillance and monitoring to identify such events, and also to educate clinicians on how best to manage them, and indeed to educate the vaccine recipients on what signs and symptoms they need to look out for, so that they can seek early care to prevent complications from these events happening. So we are working on many fronts to minimize the impact of these events and prevent them. And as we have more information, we will be sharing them with member states, including the Philippines.
Dr. Rabi, I'll read some questions from our media partners. This is from Hardlene Delgado of UNTV. The British Medical Journal published an editorial recognizing the airborne spread of SARS-CoV-2 and emphasizing the need to improve indoor air quality through better ventilation. It also noted that aerosol scientists have shown that even talking and breathing are aerosol-generating procedures. What's the WHO's take on this? Should the country consider reviewing its policies and now focus its efforts in curbing COVID-19 airborne transmission?
So we are aware of this, and we are looking at these conclusions carefully. We still recognize that this is not a big risk factor. We have to take it in the context of relative risk. We continue to emphasize that the aerosols generated, whether it's through talking, coughing, or sneezing, can be controlled by the wearing of masks, and that's why WHO has been advocating for the wearing of masks. to prevent the likelihood of these aerosols landing on surfaces or on other people. While every precaution needs to be taken, we are also conscious of the fact that unless we have a clear impact analysis of what degree of transmission can be attributed to aerosol, to airborne transmission, our primary focus should be on prevention of transmission through the wearing of the masks and the hand hygiene that we have been advocating. If we are to move to more stringent use of double masking or N95 masks, etc., we need to be conscious that this is relative to the risk posed by airborne transmission. That's why WHO has clearly recommended that where airborne transmission is highly likely, especially where medical procedures are happening, that we advocate for the use of N95 masks. But if there is relatively lower risk in other circumstances, it does not justify using those precious commodities to minimize that risk to a minimum. So we continue to emphasize that it is largely aerosol-generated transmission, and we need to continue to follow what we have been advising. But we are still looking at these new reports and we are studying them. Thank you.
Okay. Dr. Rabi, our next question is from Samed Danila from Business Mirror. When is the next batch of COVID-19 vaccine from the COVAX facility is expected to arrive?
Unfortunately, I cannot confirm dates, but we are expecting a consignment within this month. So we believe that we will receive some stock of vaccine within this month and also some vaccines next month. So we are optimistic that we will continue to deliver on our commitments to the Philippines through the COVAX facility.
His next question is, has WHO already determined if the new variant of SARS-CoV-2, which was first reported in Cebu, more infectious or more fatal compared the usual kind of COVID-19?
The so-called P3 variant that has been isolated in Japan and Philippines. Yes, we are looking at this carefully and trying to compare it with the epidemiological information. The evidence we are seeing, particularly the stabilization of transmission in the Central Visayas and Cebu, indicates that this probably does not have that increased transmissibility that was originally thought to be associated with it. We are looking at the epidemiological information, looking at the number of people affected and their treatment outcomes. And this process takes time. And so as regards to severity of disease, and indeed even regarding the transmission potential of the P3 variant, we are still analyzing the data, and so we can't conclude conclusively about the potential impact of this variant. So it is still listed as a variant of interest rather than a variant of concern.
Thank you for joining us this morning, Dr. Rabi Abengasing of the World Health Organization. Mabuhay po kayo.
Thank you, Secretary.
Maraming salamat sa inyong patuloy na pagtangkilik sa ating tahanan at pagsubaybay sa mga kaganapan na nangyayari at sa ating tagumpay na natatamo dyan sa Indonesia. Hopefully, we will see you again in our next update. God bless.